So the reason I am talking to you today is very much like Lisa's presentation, is to talk to you about if your study needs lab testing or pathology materials, what do we need from for the laboratory to be able to support that need? And just like Lisa, if you're ready to start tomorrow and you need labs and you're just calling us, we got an emergency as well. So first I wanted to just mention, when we say labs, what does that mean? So this is a list, and I won't read it all to you, but these are the areas that our laboratories encompass, from the blood bank to our anatomic pathology sections, microbiology, molecular. We have a phlebotomy team that draws inpatients. We also have phlebotomists in the POC that draw outpatients. So all this is under the umbrella of the laboratories, including pathology, which sometimes, you know, people don't recognize that that's also part of our areas. And we also have an outreach area, University Medical Labs. They go out and bring specimens from other hospitals, other clinics, doctors' offices, and that kind of work back to us as well. And even some studies, we have actually used outreach, our outreach arm, if, like, let's say you need phlebotomy collections, because they do have some phlebotomists that can come to sites, and as well as just maybe a need, an off-site need that you need collections or pickup or something. Sometimes we can have our outreach help with that. But by and large, it's what goes on here within the campus. So a little bit about the laboratories. We are CLIA and CAP accredited. CLIA is a CMS obligation that all laboratories that perform testing have to have what's called a CLIA certificate. We currently have 2 now, because if you have a different physical address, you have to have a separate CLIA certificate. So when we moved our molecular lab off to what's the old PREEP building, the Operations Support Center, whatever it's called today, we had to get a separate CLIA certificate for that particular operation. So that's why you'll see that we have 2 CLIA certificates. Last year we billed about 3.3 million tests. That equates to roughly 1 million samples a year come into the labs. That's about 4,000 a day. So that's part of the reason why I'm speaking to you, is we try to incorporate the study work into the workflow of the clinical labs, but the study samples that we might get from 1 or 2 patients a day also has to work into that 4,000 samples that are flowing through the lab at any given time. And part of the bane of our existence is standardizing our processes and our workflow so that specimens move through the lab in a timely manner. But these are different. So every study is a one-off from that practice. So that's where we have to really coordinate to be sure that we know what's needed of the study, so that we can meet your all's needs as well as meet the 4,000 patients that are going to need testing from us today. Our primary reference lab is the Mayo Clinic, Mayo Medical Laboratories. So that's where that's our first choice of where we send labs, but we also can send to other clinical labs if Mayo Clinic doesn't provide it, and sometimes that's the case. If you ever have a question about a test, we have an electronic test menu, test catalog. You can look up any test we perform in our laboratory, as well as it's a joint electronic catalog with Mayo. So if it's a test we send to Mayo, it's integrated into that manual as well. And some of the tests that we send to other labs that we've chosen besides Mayo, we can also put in that manual. So it's like, it used to be a thick notebook that we try to distribute on paper, but the electronic one has made life smoother. And if you get the presentation by email, it's linked there, but you go to Connect, Lab Services, and then you can link to our lab manual. So what kind of support do we provide to clinical trials? Well, we can do lab tests in our lab. So if you need a CBC or some chemistries, things like that, we can do that testing in our lab. We can send to a reference lab, like if you have a test that we don't perform, but we can send it to Mayo, we can send it to ARUP labs, those kind of mainstream labs, LabCorp, Quest, those kind of labs. These are approved tests, so they're not research tests. So keep that in mind. We cannot perform research tests in our clinical lab or in our pathology labs. We can also provide specimens, or process specimens. So sometimes you just need us to process the sample, be it centrifugation, aliquoting, freezing it, storing it, et cetera, we can do that and then ship the samples out either as they come or at your request if you want a storage and a ship once a month, that kind of thing. And then tissue and slides, which has become more and more prevalent as we are doing more cancer studies, that we're doing a lot more tissue support and slides out of our pathology lab than we ever have before. I wrote myself some notes, some little notes, so let me remember here what. Okay. So I want to introduce Mary Ann DeVallo. She came with me. She's our point of contact in the clinical labs. So she's who takes care of the paperwork and setting the account up, getting requisitions made and those kind of things. I did it for a long time for those of you guys that have been here a while. And Mary Ann is now taking care of that. And then I'm still there and I help support her and review a lot of them too. So we work together, but she is probably more available than I am on any given day. So this is the information that we absolutely have to have in order for us to set up your study within the lab. We have to have a copy of your protocol. We need, which I didn't include that, did I? We need a copy of the protocol. We need to know what the title is and the nickname, because we do like to give them catchy names, much like we do everything around here, it seems. Who's the PI? Who's the coordinator responsible? What your IRB number is, because IT requires that IRB number. They use that as the identifier within Epic. So we have to have that number. The address of where invoicing should go to, because our bills are going to generate from patient financial services, just like a patient bill does, and you'll get a monthly invoice. We need to know who that invoice needs to go to. And we need to know, and I'll get to a little more explanation, if it's an anonymous study or if it's not anonymous. And we also need to know where results are going to need to go to. If the results are just tests we perform in Epic and you can look at the results in Epic, that's fine. But if it's anonymous, or for some reason you want a paper copy of your results, we need to know where that can be, where you want that routed to. Because we can have the system auto fax it. We can have the system print to a networked IP printer usually within the hospital or the health science center. So let's answer the question. So this is one of the things that Mary Ann will ask you as soon as you send a study to the lab is this an anonymous study or a non-anonymous study? IT needs to know that for the way that they build the study, because it's important on whether or not we're going to allow results to flow to the patient's med record, or if we're not going to let it flow to the medical record. So the definition is, if it's anonymous, it means we're not going to use the patient's name or their MRN, and no results are going to go to Epic. So if you need, we're going to always use some kind of code or something like that, and it's not relevant or necessary for that information to go into the patient's med record, that's going to be an anonymous study. A non-anonymous study would be, it's perfectly fine. If you order labs on me, it's going to go to my med record. It's going to be viewable to my physician. It's going to be just like any other test. The reality is, just behind the scenes, it's going to bill to your study account. Okay, so those are the differences. We absolutely have to have this, because the way Epic works is you can create an account within just the lab system, and we can do things, and it doesn't cross over to that bigger picture of Epic. So we always have to have an answer to this question. So for example, so let's go through the several different scenarios that we might have. So you need clinical lab testing. It's not going to be anonymous, so we're going to use the patient's name. And the tests that you need are orderable in Epic. So it's the run-of-the-mill stuff, CBCs, maybe a lipid panel, some cultures, electrolytes, that kind of thing. So how are you going to go about setting up that study? There's an email in Outlook, there's a distribution group called Research Billing, and that goes to a multitude of folks. And the most importantly of that group is it goes to the IT folks that need to know this information so that they can build you an order set in Epic. So if you're doing, like I said, run-of-the-mill type test, you're going to get an order set behind the scenes. It's going to be tied to your study. You can order it on your patient. We'll run the labs, because we're not going to, let's say you need a creatinine. We're not going to do anything different with a creatinine because this patient's on a study. It's the same lab test. The important thing is that we're routing the billing correctly. So they're going to build you an order set. You're going to use that order set. If you don't use that order set, you're going to bill your patient. And then it will specifically bill to the study, and that will be taken care of all within Epic. So in reality, if you have no need for anything outside of that, you just email that research billing group. we don't really need to do anything from our standpoint. So next, so what if you need clinical lab testing, anonymous and non-anonymous, either one would, it really isn't, it's not relevant per se, but they're going to ask the question, so we have to answer it one way or another. But you just need us to process samples and ship them out. So the only thing that's going to get generated from us is a bill, because we do charge by the specimen for processing those samples. And we charge a fee for packaging up and shipping. So if you need us to process the sample, it's going to be really important that we get a copy of the lab manual. So with your protocol, there should be a lab manual. Covance is an example, Quintiles, those type of labs where you send samples to that we process. So to Mary Ann, you need to send a protocol, your IRB approval letter, we've developed a research request form, which I'm going to set up here if anybody would like to take, because it kind of goes along with these slides, and it gives us the information that we need in one place, pathology and clin labs included. So if you'll take that copy, we'll be glad to email it out, but this would be helpful to get this completed when you send us a study, so we have that information. So send that to Mary Ann, including the lab manual, because the lab manual is going to be the key that tells us how we're going to process those samples. Used to years ago, they seem simpler. Now they're even more complicated than they've ever been. It seems like you have to, spin this tube and do this with this tube and all these types of things. And like going back to what I said before, if we're getting 4,000 samples a day, and this is the one thing that's handled different than everything else we've received today, we really need to give our staff the guidance to be able to do that. We don't have people dedicated specifically to this because we need it to be able to go into our workflow 24/7. So we need it to be able to be handled by any of the staff that potentially could process a sample. So this is what you need to do, and this is just a little snippet of what the top of what we call the blue sheets, because we always use blue paper. It helps our staff. It's kind of that visual that they know it's a study because it's on blue paper for that requisition that we're going to give you. So what if you need in-house testing and you need us to process some samples? So in a non-anonymous situation, you're going to do the same thing that you did for the ones that you need to be orderable in Epic. You're going to send the email to the research billing group, because that's going to be the people to make you an order set. And then you're also, though, going to need to send to Mary Ann the things that you would have sent because you need us to process samples. We need the protocol, we need the IRB, we need the request form, and we need the lab manual that explains what you need us to process. And sometimes it's not very clear. I mean, the protocol talks about all these labs, and then, you look at it and you think, okay, we're going to perform it. And then somewhere in like one little sentence, it mentions they're going to go to a central lab. Well, then we need a central lab manual to support what that processing looks like. We'd like, so an order set will be created for those tests that we perform in-house. You'll take care of ordering those that way. And then a blue sheet will be created for how we're going to process those samples that are just going to come to us for processing and send out. A good example is the regular labs are going to be done for us, but the patient has PK samples. So those PK samples, those may be what's going to come to the lab for processing. We're going to store them and ship them once a month, but you're going to do CBCs and electrolytes and things like that through your order set. Okay, does that make sense? Are we good so far? So next, let's say you have in-house testing and central lab. So this is going to be a little bit different in the fact that we talked about if we do the test in-house, you're always going to have that order set. Well, if your patient's going to be anonymous, we can't order that through Epic, because we're not going to put patients that have a name like Mickey Mouse. We're not going to put non-patients into Epic. So if you need tests to be performed in-house and to be processed and it's anonymous, we're going to have to make you a blue sheet. So because we're going to need to bring it to the lab, and we're going to need to order it in such a way that the results don't cross over to Epic. We're going to use whatever code, whatever number you want us to use in identifying that patient, and we're going to send you those results on paper. Nothing's going to go over to Epic in that situation. Okay, but the needs are the same as to what needs to go to Mary Ann. Protocol, form, IRB, lab manual. Okay. So next, let's talk about pathology. But let me pause. Does anyone have any questions about the clinical lab stuff and how one of the things I did mention that we do charge a fee for the specimen processing. It's by tube. So you need to build that in your budgets because we do, you know, that's a lot of manual work that we need to account for within the department. And if you've already, back on the ones that are going to need both a blue sheet and may have an epic order, if you've already submitted for the epic order, let Mary Ann know that, because the account that exists in Epic is still usable for our purposes. They're not two different accounts. It's just something else is going to be needed to be done in Beaker, which is the lab system. So let Mary Ann know that. I've already sent the email to Research Billing, an order set's in process, because then she can tap in to the work that IT is already doing to build the account, and then we can take it one step further and get the lab part built. Same is true as we talk about, and I have some helpful hints at the end, so I'm giving those away early, it appears. If it has clin lab work and pathology needs, let her know that too, because the account's still going to be the same in Epic. It's just we have to build it in Beaker, which is for the clin lab side, and CoPath for the pathology side. Okay, so let's say you need tissue or slides from our pathology lab. So you're going to do the same thing you did with the clin lab studies. You're going to email Mary Ann. She needs the protocol. She needs the IRB. She needs the request form that gives us a lot of good information, as well as the lab manual. So the lab manual sometimes goes into more extensive detail on what they need specifically for the tissue. She'll create a blue sheet with what the tissue needs are. Sometimes it's slides, sometimes it's other things. The study account will be billed just like for the clinical labs. It'll be a monthly invoice from Patient Financial Services. And when you need to pick those things up, you'll pick those up from the histology lab. Does everybody know where that is? Second floor, Health Science Center. So that's where our histology lab is, and that's where you would pick up any tissues or slides that you need. So it's not our policy in our routine practice to release blocks or the tissue itself. Some studies offer an alternative, but if it offers an alternative of slides with the tissue, we're always going to choose the slides, because we need to keep the tissue and the block here on site if at all possible, because especially today, because there's so many molecular tests, there's a lot of need to go back and test folks on archived tissue for their standard of care as well. So we don't want there to be no tissue available in case there's other things that need to be tested for. And there's also legal ramifications. If we had a tissue and there's some question legally on a diagnosis, we try to keep the tissue on hand. So if slides are offered as a choice, we're gonna go with the slide choice. If they absolutely insist that this study only will allow for the tissue blocks in order to participate, we will, with prior approval by our medical director, we have to have the anatomic pathology medical director review that protocol for us and make sure that he's on board in allowing that to be the case. Or more and more frequently, we've been seeing that the study requires the patient to have a tissue biopsy completed just for the study. And if it's just for study purposes, we like to ensure we're going to have you mark on the blue sheet, and that our expectation is the patient has been consented and agreed to that biopsy for study only purposes, because we can't diagnose or do anything with that if we hand it off to a sponsor and it's gone. If they need both, then we'll do both, but we're going to hold that tissue until we've done our part. Okay. So here's a few just helpful hints, like I mentioned. If it has both clinical lab and pathology work, request it together. If we need a point of contact, so when you say someone's the coordinator, if you know that coordinator is only here one day a week, give us a couple of options, because that blue sheet is like a requisition that comes to the lab. So if that sample comes to the lab and we find out that it's not testable, it gets spilled, there's an issue of some sort, we have a question about whether we're shipping that day or not, we need somebody that we can contact when those samples are dropped, because stability could be an issue and we need a point of contact that we can reach. Okay. If there's more than one coordinator working on the particular study, let Mary Ann know that so that she can put both folks on the blue sheet as a point of contact. If the coordinator changes, which sometimes happens, please let Mary Ann know that too, because we don't want to keep putting requisitions into the lab and there be a question and, you know, find out, well, that person hasn't been here for 2 years or a year or whatever. We want to be able to contact the relevant person at the time. And if you haven't gotten it to Mary Ann yet, and today you need to send a sample to the lab, just mark through the blue sheet and put the right name. That's fine. She looks at those every day. She could catch it that way and fix it, but it'd be nice if you notified her ahead of time. And if we have incomplete information, so if we just get an email that says, hey, here's a study, and we get a copy of a protocol or a snippet and it says we're starting tomorrow, we can't turn that around like that. Mary Ann works, she also has a lot of other duties besides studies. She does a lot of the billing for our lab, and also IT. It's a process. There's no way to move like the wheels of justice. The wheels of IT move at a certain speed. So nothing bad about IT. It's just the reality. Everything has an IT component, and we can't. We want to try to prevent calling them with emergencies that we could have had some preventable way to have done this ahead of time. Okay. So there's Mary Ann's email and phone number so that she can be reached. There's also mine. So if you ever have any questions or anything, if you have folks outside that aren't here, please, we're going to put the form and we're going to put this presentation on our webpage, because there's lots of new folks out there that seem to don't have a lot of guidance on what they're supposed to do. And I think Mary Ann is hoping that this, and if we can get the information out, it's going to help us with that. All right, I think the walls are coming down, so I think that's probably a sign.